Welcome to Keep It Off with Keo. You have lost loads and loads of weight, and it doesn't matter whether you had weight loss surgery or you've used weight loss injections, or even if you've managed to lose it organically, because either way, it's absolutely fantastic. And now you need to discover how to keep that weight off for life. You're going to find our podcast to be the only fact-based, no bullshit podcast that deals and addresses directly the challenges that you will face in keeping on track here on in. I'm Mel Harris, the founder of the Keo Method, and I'm really thrilled that you're here. I hope that you come away from this episode inspired and motivated, but let me know what you think, because I love getting your feedback. And if there's a specific topic or question you'd like me to address, let me know on WhatsApp. You'll be able to find out more on our website, keomethod.com, and on our socials, the details of which you will find in the show notes. You know what to do. Don't forget, subscribe, like, and comment. Today I'm going to be speaking to a lady called Sonya Black, and Sonya is a CBT therapist. CBT stands for Cognitive Behavioral Therapy, which basically means being aware of how you behave and learning whether or not you need to change any of those behaviours. Now, Sonya's been doing this for well over 20 years. She really knows her stuff. She's a lovely, lovely lady. She has a serenity about her that is infectious. I am pretty sure that she's going to give you some idea of how you will be able to use CBT to help you stay on track and live your best life. And with the support that you get here from Keo, you really can marry the two together and get the best out of it. So please enjoy. And I'm now bringing in Sonya Black. Sonya, thank you so much for joining me. I really appreciate your time. It's fantastic. Now, I know that you're a CBT coach, so I would like you, please, to just explain to me and to our listeners, what is CBT?
Yeah, I'm a CBT psychotherapist, and thank you so much for having me here. CBT, there's lots of different views on CBT. I think people sort of have lots of ideas as to what it actually is. But really, if you just think about it very simply, it's the interaction between our thoughts, our behaviours, our bodily sensations, and our emotions. And as those come up for us, it's about the patterns that play out, and recognising and realising through CBT therapy and through coaching that we have a choice in those things, and there's some things that have become unhelpful through life, and some that we'd like to make helpful or keep the helpful things.
Yeah, that's brilliant, because actually you mentioned that word, that key word, choices, because so many people believe they have no choice. And particularly with people that have eating disorders such as obesity, you'll often hear my community, me in the day, saying, it wasn't my fault, I had no choice, the food was calling me, I felt out of control. But actually, we do have choices, don't we? So how does CBT help people like me, like our listeners, recognise those choices?
There's something there, isn't there, about being able to say, actually, how do I want things to be? Recognising that these are habitual patterns that we've got. They might be very old. They might be coping strategies for things that have gone before. And it's being able to say, well, actually, how do I want things to be? What are those goals like? And making those goals as vivid as we possibly can, so that we can recognise when that self-sabotage comes in, when those self-limiting behaviours or thoughts come in. We're able to just pause, we're able to take a moment, we're able to stop and reconsider and bring ourselves back to this moment and realign ourselves with actually where we really want to be.
And actually living in the moment is really important, isn't it? And especially for people that have lost a huge amount of weight, whether they've done it with surgery or whether they've done it with weight loss jabs, it's regardless how they've lost the weight. What happens is that afterwards, because they have either a smaller stomach or they have a lesser appetite because of the hormones that are being injected. Whereas before they would use food as their coping mechanism, they would use it for comfort. They would use it if they were feeling a bit down. They would use it even as a reward. In fact, it was an emotional reason for using food as a coping mechanism for life. And obviously, they're now in a situation where that coping mechanism has been taken away from them. So, would CBT teach people how to find a new coping mechanism, or would it teach people to deal with the stresses and strains of everyday life without a so-called coping mechanism?
I think there's one thing feeling life's discomfort, but wouldn't that be quite cruel not to have a way to end that difficulty?
Mm.
So I think there's something about being able to say with a more compassionate view, recognizing that compassion would be defined as recognizing that difficulty exists with a desire to end that difficulty. And that's the important bit, that second
Right.
bit.
Yeah.
So that's where coping strategies come in, new coping strategies to replace the old behaviours and ways of thinking and behaving. But they're so habitual, they're so entrenched within us. Sometimes they come from such a deep place. It's being able to sort of, I often describe it to clients as bubbles bubbling up to the surface, and we're able to catch those, we're able to observe those, take that observer stance with ourselves so that we're able to say, actually, what, and the biggest question I think is what are my needs? What are my
Mm.
needs at the moment? And so much of this eating, for example, could become, or drinking too much, or whatever types of unhelpful behaviour, is something about unmet needs, and it's the hardest question to be able to answer.
I was going
And
to
that
say,
can time. What it's not about a bath with candles, as per Instagram. It's not going off to yoga
mm,
class necessarily. Might be that, but it's actually something about that deep sense, that deep felt sense of what my needs are.
yeah, and I think that's really, really important because you're right. At the end of the day, when somebody is faced with, I need to eat that food, I need to eat the chocolate, I need to eat the cake, or whatever it might be, they're very often completely unaware of why they need to eat that at that moment in time. Because, like you say, it's deeply hidden in our subconscious and it's just something we've got used to. That's how we deal with things. So, what I want to ask you is, when those things happen, how can they, I mean, if you had stopped me at a time when I was desperate to eat something and said, well, what are your needs right now? My needs are to eat that food, go away, leave me alone.
Mm.
What steps would you take with CBT to help me realize, no, actually, Mel, that's not what you need right now? What would you talk about? What sort of questions would you ask them? How would you bring something so deep inside them up to the surface?
Is it always? I think CBT is often that sort of we're working at that surface level, but we can work at a much deeper level as well with our old core beliefs, ways experience in life or experiences in life. I've never met a human that doesn't make sense in the context of their life and their experiences. Everything makes sense. So there's something there about being able to meet those two things. And if that person, something about working with that person to say, actually, how do you want things to be? If I were a fly on the wall, when this problem is no longer here, or when this situation is no longer here, what would I be seeing that's different about you? And being able to make make that a really clear visual for that person, that this is about working towards this new way of being, this new way of living, this new way of experiencing oneself and also life as well. That it's bigger than just this moment where emotions feel overpowering, overwhelming, and you're reaching for the food.
Mm.
It's being bring yourself back and the wisest, kindest thing for you in this moment. Is it really the food, or what else is it that you need?
And now that actually makes a lot of sense. It's almost like saying to somebody, um, okay, imagine in an ideal world that you weren't craving food, you were your slim self. Now paint a picture of what you need to enjoy that new you, new world. and let's
Yeah.
work on that. And then we'll get to the crux of what your needs really are that are not being met.
Yes, and also life is going to be difficult at
Mm.
times. That is life. Life is going to contain pain and difficult moments and suffering at times. But the suffering is what we do to ourselves.
Yeah,
You
that's
know,
a key thing. I'm going to come back to that in a minute because I agree with you. Because actually, you also mentioned self sabotage a moment ago.
yeah,
And a lot of people will self sabotage at the point they've made progress. Yeah, they've
yeah,
done really, really well. They've actually had visible success. You know, they and people around them can actually see that they've lost weight, they're looking great, and suddenly they start to self sabotage. What's going on in their head at that moment? Why would they literally want to screw things up just at the point where everything's going well? And what CBT techniques can we use that they could kind of stop themselves from doing that?
it's an interesting one, isn't it?
Mm.
Because we all do that to some level throughout life, and there's something about we're returning to those familiar patterns of thinking, behavior, feeling, experiencing. And there's something about where we feel these things in our body most. And that's often our clue, is that somatic experience. Where are we feeling this in ourselves? And the thoughts come afterwards. If you think anxiety arrives usually within 0.03 of a second, and that's really useful when you're walking down the street and a big bus comes towards you, you need to jump back before you can think about it. And that's often where these behaviours come in. So it's we're reaching for something before we've actually really thought that through and considered, does this actually meet my goals and how I want life to be? So it's being able to take that moment, being able to pause, being able to say, well, actually, this is something about, my ability to comfort myself or be in this moment with myself.
Hmm. Can you give me another example, or give us, sorry, another example of what you mean by where that anxiety sits within your body?
Yeah. So if you think about that, if you just even sort of give yourself a moment to consider the last time something, call it not out of five, something fairly low level like a one or something that
Mm.
triggered your anxiety within you. Where do you feel that in your body? Is it in your chest? Is it in your tummy?
Uh-huh.
Does your heart? Can you feel your heart racing? You feel a bit hot and jittery. And when you're actually experiencing that, the cognitive processes, it's triggered by something called the amygdala deep within our brains. It's a really old structure. And we've got our tricky thinking brains that sit over the top of that. And when this amygdala, which is designed for our survival, gets triggered, it actually then starts to impair, like a light bulb fusing, the functions that we need to be able to rationalize to ourselves.
Mm.
And so it's releasing adrenaline, noradrenaline, cortisol, all sorts of other chemicals, which then we end up having a bodily experience of anxiety.
And what would the first step be once you've kind of thought, oh, yeah, that's something's happening here because I've got this feeling in my stomach, or, oh my God, I've broken out into a sweat, or whatever the physical manifestation might be? They've recognized it, they're feeling it. What would their next step be?
That's where, there's a range. If we're dealing with anxiety, and it's anxiety that's driving this, there's a range. It's about having like a toolbox
Mm.
that you can go to. So what's in that toolbox? And that gets personalized and individualized for each person. But there's lots of go-to places that we have within CBT. So it might be a breathing exercises. So simple breathing exercises. There's breathing for breathing at the moment. And there's something about simplifying that to just breathing out for longer than you're breathing in.
Right.
So you breathe in for 3 on the in-breath and you breathe out for 6. That instantly, if you think about it, the spine connects up with the base of our skulls, and the chest, when we breathe consciously, deeply, expands this way, that way, but also the spine moves and has a soothing effect on the brain. So that's
Mm.
the simplest place to go to. Just breathe for a moment. Take a
And at a
couple of
base level, that makes a lot of sense because
yeah.
um, we know that we breathe, we don't think about breathing, and we know that breathing is essential to keep us alive. If we're not breathing, we're not alive. But we also know that, it's used almost every single day to help with pain. Um, when women give birth, they are taught to breathe very deeply and very heavily to alleviate some of that pain and to help them get through that pain. And I know I've had experiences when I've had a really bad stomachache or something where I've gone, literally breathing heavily from my diaphragm to alleviate that
Mm.
intense pain. So it makes sense that breathing can have a very, very big effect on anxiety as well as just physical pain, because actually
Yeah.
it's kind of like an emotional pain, isn't it? It's a mental pain, so it's still a pain of sorts.
So what's the food actually doing, and it's interesting to explore that perhaps for clients or your clients to be able to sort of just, what's the function of the eating at the moment? What purpose does that serve? And so is it something about actually just trying to keep those emotions down, just not allowing them to be, because there's some people feel quite overwhelming. So then it's about building a repertoire, if you like, or that toolbox of other strategies then that you can have that soothe you, that comfort you, that are coping strategies for life. And they're healthy and they're not destructive, and they are going to help you to achieve your goals long term. But that's really hard to do. So if we're coming back to that neurobiological kind of idea of the brain actually being an organ that's doing things for us on our behalf, whether we want it to or not, in the same way our kidneys function, whether we want it to or not. It's about being able to say, right, okay, this is about neurons in our brain like to connect. They want to connect. So an old dog 100% can learn new tricks. And it's being able to say what we're actually doing in therapy through really simple, and CBT through super simple techniques, is we're bit by bit teaching the brain that I'm safe, I can cope, I've got this.
Absolutely fascinating. Does that work for all levels of, I guess you'd call it negative thinking? So, for example, certainly within people that have issues with food and obesity, etc., it's very, very common to hear people say that they've got this all or nothing mentality.
Mm.
And it's a culture whereby if you mess up today, if you eat something, oh, fine, forget it, I'm giving up. What's the point? So it's
Yeah.
like either I'm doing it all correctly or I'm just going to do nothing and give up.
Yeah.
Is that a similar mindset that CBT can help? Or is it the same methodology as you've just mentioned for self-sabotage?
No, that all or nothing thinking, that black and white thinking is a whole entity in itself as well. It's one of those common thinking errors that we all get into, or patterns of thinking. And it's been able to say, well, actually recognize it again, and that self-awareness, but also then being able to bring it to, actually, what does the middle ground look like? If I'm going from 0 to 100% and then back again, what does actually 50% look like? What does 75% look like? What's it like to just be in this moment, to accept that there's progress, not defeat, and it's little steps, it's building blocks. And we're not going to, if we wanted to set a goal, the goal could be up here and we could be down here looking up at it. And what we're actually trying to do, that feels overwhelming. That feels unachievable. That feels like we're not going to be able to get to that point. What we're looking to be able to do is build these little steps to get to the place that we actually want to be. And each of those little places that we get to, it's a bit like if you're climbing, you'd need to traverse, you need to practice the skills. You might stay there for a little bit and then you move on to the next level. Computer games, whatever the analogy is, the
Yeah.
description is that works best for people. But it's being able to say it's about consistency. So there's some research that came out about 60 days, 10 to 15 minutes a day of consistent effort. And that is quite an interesting thing, because that's quite consistent with the course of therapy, over 60 days, over 8 to 12 weeks, of being able to say this is just about consistent effort each day, but having the big goal in mind, but making sure that you've got plenty of the small ones that keep you motivated along the way.
Yeah, don't just go straight in for the ultimate. You've got to start somewhere. So start at the bottom and work your way up. And so is this study saying that basically if you do 10 to 15 minutes of practice, which is what it is, every single day for 60 days, it will generate results. You'll see
Yeah,
changes.
absolutely. And I think you can see those much sooner than that as well.
Mm.
You know, we're starting at sort of whichever level the client would be at, and we're tailoring that to each and every client. So it's not a one size fits all, but it's about, and also, for, you know, what's it like to approach ourselves with curiosity, with beginner's mind,
Mm.
to take that observer stance with ourselves, to be able to say, oh, okay, this is what my brain wants me to do, and this is where I would go to automatically. And we're looking to be able to catch those automatic patterns of thinking, of behaviour, and just being able to hold on to that for a moment and go, how else would I like this to be? What else would I like to be there instead?
Mm. I mean, it sounds to me like CBT really focuses on kind of replacing unhelpful thoughts with more balanced ones. Would you say that's a fair description?
Yeah, I think so. But without it being surgery, you know, I think it's sort of, we're not diving in there and going, right, don't think that, because that wouldn't work, because thought suppression doesn't work.
Mm.
What we're trying to do, what we work on doing with CBT is making it evidence-based. I could tell you you're beautiful and you're perfect just as you are, and
Mm-hmm.
you wouldn't believe. And you wouldn't believe me because that isn't aligned to how you view yourself and your beliefs and your evidence base. So what we're working on with CBT is to create, little by little, your own point of reference that makes sense to you, that's evidence-based for you, that creates that change that's lasting for you.
Yeah, that makes sense because I was actually going to follow that on with, if someone genuinely believes that they are unworthy or unlovable or broken in some way, this would be the technique then that you would use to help them. I hate saying fix that because it would suggest that they are broken in some way, which I don't believe anybody is. But it would certainly help them to become aware of how they see themselves and what they believe about themselves and turn it around.
To work on changing one's beliefs and how we actually really truly view ourselves is quite deep work. And there's lots of techniques and interventions that we could use with clients that helps to achieve that. This is just one of them. That idea of unworthy, unbroken, it's yeah, there's a lot more to unpack with that, perhaps maybe around experiences in life, what's led to that. Maybe there's some traumas, big T and little t traumas in there as well. So it's been able to bring that to the fore and to be able to work with that if needed. But you know, there's different levels with CBT, and we're looking at being able to say, actually, if you broke your leg and you went into A&E, you would actually maybe, they'd say, oh gosh, that looks painful, give you some pain relief, sit you down, having taken a very brief history. Then they'd x-ray it, they'd make sure that was really what was the issue. Then they'd give you the treatment for that. Maybe it's a plaster cast or boot or whatever it might be. And they'd ask you to rest and eat well and maybe not drink alcohol and take care of yourself. And, you know, the usual care advice. And then you come back, get it checked, maybe have a little bit of physio after treatment, and you're okay. And it's just experience. What they don't start doing is asking, you know, how old were you when you first started to learn to walk? They might ask you how you did it. Oh, I slipped down a couple of steps. Okay, that's fine. They accept it. And CBT is a bit like that. We're not going all the way back because our immediate concern is, how do we help a client to experience life in a better way? What tools do they need in the toolbox? Just what treatments do they need at this moment to minimise any more pain and suffering? But if it feels stuck, then we go backwards. And then we need to be able to say, well, actually, what, you know, we call it the formulation. I think about it like a jigsaw puzzle. And we're putting the jigsaw puzzle of you together, and everything makes sense when we put the puzzle together. There might be things that we want to, in the context of your life, your experiences, and what's happened. And there may be things that the client decides that actually that's not really helping me. And some of those core beliefs might be those things.
Earlier on, you said that you kind of deal with the now,
Mm-hmm.
but from what you were just saying, you actually do go back if you feel it's necessary into your, past, not old life, but, when you were a child or however far you need to go back to help people that feel stuck in a belief pattern. I mean, do you use CBT with any other forms of therapy? Because very often, food issues are very much behaviours and beliefs that do come from childhood or maybe trauma, but certainly something in the past.
Mm.
It's very rare that you'll find somebody who has had a very healthy relationship with food, always been healthy, and then suddenly at the age of 42 decide, you know what, I'm going to start eating like I'm starving, and then become very, very overweight or even obese. It's very rare for that to happen. Usually it will start that the kind of the seeds are sown at a very early age. So is CBT enough on its own to help people like that, to help people to challenge those old belief systems, those things that are ingrained into them? Or would you use other techniques in collaboration with CBT, particularly with people that are struggling with weight and always self-sabotaging or pressing the disrupt button and going back to old behavior patterns?
Yeah, I think there's something about just bearing in mind that, the past informs the present. So it's, we are a product of our past largely. And it's our choice then of how we want to be in the present. And we do have a choice with that, even though it can feel like it's just a path that's put before us and we're just on it. We can choose how we are on that path. We can choose how we are in this moment. And CBT very much can work with that whole formulation driven therapy to be able to work with difficulties in the past. That's why we're able to work with trauma, for example, a complex trauma, and complex PTSD, and that's where CBT comes in. It's about recovery, as well as being able to reprocess some of those difficult beliefs, memories that lead us to not living the life that we actually really want to be able to live.
And I mean, is there, I don't know, one CBT concept that you wish everybody understood really well? Obviously, I'm referring particularly to my community. Is there one concept you wish that everybody understood that you can explain?
Do you know what? There's so many. There are so many. I think the one thing that I'm always really keen for clients to recognise is that we're just a work in progress. We're just human. And we're human animals, and our brain sometimes takes over. And it's being able to work with that. Our thoughts are not facts. They're events of our mind. And when we start to be able to say, okay, I can take that, I can be kind to myself, I can be compassionate to myself, I can be patient with myself, I can care for myself, I can pause here and take what I need in this moment, because that's the moment where there's growth. It's about progress, not perfection.
Oh, I like that.
Yeah.
Yeah, I like that. I mean, work in progress is something that I say all the time to all of my community, particularly about me. I am and always will be a work in progress. We all will be. We all evolve every single day. And yeah, I think that was beautifully put. Thank you so much. That was brilliant. So, as a general thing, would you say that CBT is a really good, helpful therapy platform for people who are suffering with any kind of eating disorder, really? But obviously, for my listeners, people that have suffered with obesity and now they're struggling, even though they've lost an amazing amount of weight, they're struggling to keep it off.
Yeah. I think it'd be very quick and easy, wouldn't it, to say that CBT, yes, of course I can do that. But I think the real answer is more than just that. So I think CBT offers a great deal in terms of understanding techniques, strategies, and treatment options. But it's also considering that CBT is also more and more CBT therapies, so it becomes an umbrella for other therapies, and there are other therapies outside of CBT, so compassion-focused therapy, interpersonal therapy, EMDR, and there's a range of other therapies, and that's to say nothing about the whole psychodynamic and counselling field, but it's been able to say there's a range of options there for people. And when I've worked with clients, I think my 20 years I've been or plus years I've been a therapist has taught me that clients will tell me time and time again it's about the right therapist and that relationship. It's about the right type of therapy at that right time, rather than just saying, do this and it will be fixed.
Yeah, no, I agree with
For
that.
me, like CBT is a way of life.
Yeah.
And it's bringing in a range of different options.
Yeah, I have to agree with you. I think it's very important to find a therapist that you resonate with, somebody that you feel, yes, this is the person that can help me. But it's also, would you agree, you've got to have an open mind yourself. You have to accept that if you want things to change, you have to change something to make those changes happen.
Absolutely. No fairy wings, no magic wands.
Yeah.
I'm working collaboratively with clients
Yeah.
for change, rather than actually being able to have all the answers, all the solutions. What we're doing is being able to say, here's some ideas that fit within models of therapy. Do these fit with your experience and what you're able to do? And it's being able to meet that client where they're at. But the other thing I often say to clients is there's 168 hours in the week and you've only got 1 hour in therapy. The rest is over to you.
Very good. I love that. And it's true, isn't it? Whatever you do in life, you can get advice, you can read books, you can talk to people, but ultimately you've got to be the one to go away and take the action.
Yeah.
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 Change doesn't happen without action.
Yeah. With support, with care.
Yeah,
But
absolutely.
ultimately, yeah.
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 So if anybody who's listening today, I'm sure that you've gleaned an awful lot from what Sonya has been talking about. But if anybody today wants to get in touch with you, obviously we will put all your links and information in the show notes. But tell us where we can find you, how people can get hold of you.
Yeah, I'm on Sonya CBT on Instagram. My website's very simple. It's sonyacbt.com. And they can also just email me, have a look on my Substack where the therapy toolbox is as well.
Oh, Sonya, I could talk to you about this all day. There are so many more questions I would love to answer. I've asked you, but I know that you're on a tight schedule. You've got clients to see and what have you. And I wish you all the best of luck with that. Thank you so much for spending some time with us and for also sharing so openly all about CBT and being honest and saying, look, ultimately, yes, there are things we can do. There's lots of different therapies, but you're the one that has to do the work. And I think that's really important for people to take away with them. Thank you very, very much indeed.
Oh, thank you, Mel, for having me.
Oh, you're welcome. Let's have you back another time.
That'd be lovely.
All right. You take care.